Good evening and welcome to Tuesday Night Lupus Club. With us tonight is Dr. Winn Chatham to talk a little bit about the COVID vaccine booster before we start our presentation on parenting and lupus. Dr. Chatham, thank you for joining us.
Okay, just a quick update that's come out in the last week. The FDA, with the CDC's assent, has come out with another use authorization for a third dose of vaccine for patients that have underlying immunosuppression or significant immune deficiency. So this will impact a lot of the lupus patients who, many of whom are on what they are considering the immunosuppressive therapy in terms of who they're wanting to target with this third dose. So most of the experience with the current Pfizer vaccine is where most of the data is, because that was the first one that came out. But for people who are not immune suppressed, we know that the titer of the protective antibody to the COVID-19 spike viruses will decrease over time, such that after about 6 months, the titers are about half what they were 1 month post-immunization. For patients on immunosuppressive therapy, there is some increasing evidence that those patients don't make as high a titer to the antibody when they receive their initial first 2 doses of that vaccine. And the same is applicable to the Moderna vaccine as well, although there's just not as much data for that in this regard as there has been with the Pfizer vaccine. There's probably even less data with the Johnson & Johnson vaccine, which is a single dose vaccine. But most patients have gotten received either the Pfizer or the Moderna vaccine. And so this is what this particular guidance addresses. So bottom line is, if you are on, and I'll try to relate this to the therapies we use in lupus, but if you've currently been taking or have in recent months, particularly after the time you got vaccinated, either azathioprine, mycophenolate, mycophenolic acid, or been dosed with cyclophosphamide, all those would be considered immunosuppressive therapies. And it's recommended that you go ahead now to get a third dose of the vaccine, provided you got the first 2 doses at least a month ago, or provided you got the second dose of either of those vaccines at least 1 month ago. Because there's evidence now that that third dose may actually increase the likelihood that you'll attain protective titers that will last as long as we'd like for it to. Other therapies that lupus patients use, such as hydroxychloroquine and probably Benlysta, belimumab, probably would not apply to this immunosuppressive consideration, because those are really considered more immunomodulatory drugs. We talked about this a little bit a couple of weeks ago, the difference between those two. But those particular treatments, we know, don't really impair vaccine responses. So at this point, it's not necessary to get a third dose. However, once 6 to 8 months have elapsed since you received the second dose of those vaccines, I anticipate that there's going to be an additional authorization coming out for patients without immunosuppressive therapy to get a third dose of vaccine because of that waning of titer that I alluded to earlier. Other medications that lupus patients may be on that would apply to the immunosuppressive category would probably be leflunomide. If you're on that, that would probably be considered in this immunosuppressive group where you should get a third dose of vaccine. Methotrexate, probably you could consider, if you're interested in getting a third dose now, you could do that. If you have that, that would probably, at least on paper, qualify you. Most of the doses of methotrexate we use are probably more anti-inflammatory than they are immune suppressive. However, if you happen to get the first 2 doses of vaccine while you were taking methotrexate, we know that methotrexate can attenuate your ability to respond to a vaccine. So while methotrexate may not impair your ability to respond to the virus if you've been previously vaccinated, like some of these other immunosuppressives can, if you got vaccinated while on methotrexate and didn't hold it around the time of the immunization, chances are very likely that you didn't respond. I think you definitely should get a third dose of vaccine this time around, being sure you hold the methotrexate at least a week before dosing. As I was saying, it's more of an anti-inflammatory drug than an immune suppressive drug at the doses that are used in lupus patients. So it should not impair your ability to mount a good response to the virus if you get infected. But if you got vaccinated while taking methotrexate, we know that methotrexate can impair your ability to respond to a vaccine if you get vaccinated while taking it. So if that applied to you, you should definitely go ahead and get the third dose of vaccine this time around, holding the methotrexate at least a week before you get this third dose of vaccine, and not resuming the methotrexate until 2 weeks have passed since you got dosed. Those are the main ones we worry about. Rituximab is the other one. So if you've been on rituximab as part of your treatment, that would be another situation where you should definitely get a third dose of vaccine, preferably after it's been at least 4 to 5 months since you got the last dose of rituximab. So if you just got rituximab a month ago, if you get a vaccine dose now, you're probably not going to respond to it. I would wait at least 3 months before getting the third dose of vaccine. Orencia is another one. If you got vaccinated while on Orencia and didn't hold it for the month before and after, you should get a third dose of vaccine for sure. Again, when you get that third dose, get it 4 weeks after your last Orencia dose, or hold the Orencia for at least several weeks before you dose, and don't resume it till a month has passed since you received the vaccine. And I can't think of any others that we worry about, but it's mostly the potent immunosuppressives like azathioprine, mycophenolate, mycophenolic acid, Cytoxan. The two biologics that can definitely impair the vaccine response are Orencia and rituximab. And just remember, if you're on methotrexate, you need to hold it a week before, 2 weeks after getting any booster or third dose of vaccine. If you're on some of the trial drugs that are JAK or TYK2 inhibitors, you should consider yourself on an immunosuppressant and get a third dose of vaccine. We usually recommend that you hold that drug a week or two after getting vaccinated, just to enhance the likelihood of getting vaccinated. But if you're on a trial, that's something that needs to be discussed with the trial managers, because they don't want you missing doses of drug. So in that case, that's just something you would need to discuss with the trial manager. The question is, do you need to hold the azathioprine when you get vaccinated? The ACR is coming out with some guidance on that in terms of what to do with those types of immune suppressive post-vaccination. And I guess the consensus was to hold that for 2 weeks after the immunization. Again, not a lot of data to inform that decision, but the consensus opinion is it would be to improve the likelihood that you have a good response would be to hold the azathioprine. Same would apply to mycophenolate. Hold it for a couple weeks after the vaccine is administered to give yourself the best chance to respond, and after 2 weeks, then resume it.
Right. Well, Dr. Chatham, so generally the best advice is to reach out to your own rheumatologist and do a good safety check.
Yeah, I mean, I think that's a good idea. I mean, at our call center, we've kind of outlined this in terms of, what we're going to tell you when you call us. So we will usually we have our staff inform the patient that if you're taking this drug, you should get the third dose now. If you're just taking Plaquenil or just taking Benlysta or the two of those together even, it's not necessary that you get a third dose of vaccine at this time. You can wait until the 6 to 8 months have passed, when everybody else that's not immunosuppressed is likely going to be recommended to get another dose of vaccine.
All right. Well, Dr. Chatham, thank you so much for jumping in with us tonight and taking the time. We really appreciate it.